Hello, everyone. Thank you for attending this important session where we'll be discussing on a very crucial issue titled The Impact of Racism on the Social Determinants of Mental Health of Black People in Canada. This presentation will shed light on how racism influences the social determinants of health and has an adverse impact on the mental health of Black people in Canada. First, it's important to know or clarify some important concepts. What is race? What is racism? And what is racialization? Race is a social construct that classifies individuals into certain groups to suit societal standards. Then racism is a belief that race itself is a primary determinant of human traits and that racial differences produce an inherent superiority of a particular race over another. Then understanding race with the reality of racism brings about the concept of racialization, which is a social process where group of people are classified as different and consequently subjected to differential and unequal treatment. This can also be called systemic racism. Indeed, Canada is a multicultural nation, and a lot of it has been strengthened by immigration. However, despite every effort to strengthen multiculturalism, racism continues to be an impediment factor. Racial discrimination against Black people continues to be entrenched and normalized in the Canadian institution, policy, and practice. And oftentimes, this often gets neglected by those who do not feel its effect. Now, racism itself can be direct and indirect, and also have direct and indirect impacts. Direct racism occurs when a person is treated unfairly as a result of their personal characteristics. And indirect racism occurs when a rule applies to everyone, but however, disadvantages a certain group of people based on their personal characteristics. And this direct and indirect racism, the impacts, could be anxiety, depression, stress, and other psychosocial disorders. The social determinants of health. What are the social determinants of health? It's important to understand the social determinants of health, because since yesterday, this conference started, we keep mentioning the social determinants of health, the social determinants of health. But what are they? The social determinants of health are those non-medical factors that influences our health outcomes. The World Health Organization has stated that the social determinants of health has or have 30 to 55% influence on our health outcomes. This means that addressing or failure to address the social determinants of health has a serious impact in our health outcomes. And what are the examples of the social determinants of health? First is economic stability, such as employment, the kind of employment you have, the kind of finances that you've got. Education, social community support, neighborhood and environment, the kind of neighborhood or the kind of housing that you live in, and healthcare access. However, it's important to clarify that these lists are not exhaustive because there are various other social determinants of health. But for the purpose of this presentation, I am going to digress on 3 social determinants of health, which are economic stability, housing, and healthcare access. In Canada, Black people have a higher rate of unemployment and underemployment. And oftentimes, Black people face discrimination and barriers to unfair wages, barriers to unfair wages, barriers to professional advancement. Why is this so? It's as a result of racial discrimination. Also, a study that was conducted amongst candidates shows that candidates with Franco-Quebecois names and between Franco-Quebecois names, candidates with Franco-Quebecois names and candidates with African names showcased or indicated that those candidates with Franco-Quebecois names have higher tendency to be called for interviews more than those with African names. And this showcases racism in action. Also, there are also racial wage gaps. Even when qualified, Black people do not get paid just the same as their colleagues or contemporaries. And this often causes self-devaluation, lack of self-worth, and this stresses on the mental health or psychological strength of Black people. Again, talking about housing. Housing is an important social determinant of health. And Black people face higher rate of homelessness, higher rate of living in substandard living conditions, and housing insecurity. A study that was conducted in Toronto and Montreal showcased that Black people, landlord discrimination against Black tenants through exclusionary screening methods, refusal to rent, or imposing financial barriers continues to persist. Also, a data that was conducted in 2016 showcased that 20.6% of Black Canadians reported living in housing below standards compared to 7.7% of white Canadians. And 12.9% of Black Canadians were living in crowded conditions compared to 1.1% of white Canadians. And 8.4% of Black Canadians were living in homes in need of major repairs compared to 6.2% of white Canadians. 20.6% of Black Canadians were living in unaffordable housing when compared to 16.1% among white Canadians. This data showcases the inequality which persists as a result of racism. And this has made Black folks to be confined towards living in places or neighborhoods that are unsafe, that lack amenities. And when you live in such a place or in such precarious situation, this affects your mental health. Then we move to access to mental health care. Data has showed that Black people are reluctant to get access to mental health care. And why is this so? First is that there are barriers in place. And what are these barriers? First, geographic barriers, because obviously we talked in the previous time that they are confined to housing that lack amenities. Geographic locations, you see that a lot of Black folks live in places that do not have access to mental facilities, mental health care facilities, and this impact on it. Financial security. Black people are mostly underemployed. Also, lack of Black mental health professionals. This barrier is a reason why Black people are reluctant to get access to mental health care. Also, racial bias in healthcare. It's been shown that some health services do have implicit bias, and this leads to underdiagnosis or misdiagnosis. And as a result of this, Black people do have distrust in the healthcare system and are reluctant to get healthcare services. Again, lack of culturally competent healthcare. A lot of Black folks do immigrate from places like I am from Nigeria specifically, and I know that mental health, there are ways we treat mental health. Some people believe in some different cultural practices. And coming here, assuming I'm someone who is fixated or dogmatic in my own cultural ways, I'll be reluctant to go get healthcare that has westernized concepts. There is need to inculcate cultural values in the mental health care system. And this is also a reason why Black folks are reluctant to get mental health care. Now we have looked at these problems, what are the strategies and recommendations to help ameliorate this situation? First is an anti-racist policy reforms. Talking about the anti-racist policy reforms, it's easy to say because even as at this moment, externally, we do have anti-racist policy reforms. But the problem is about implementation. Just last night, I was talking with my professor and some of my colleagues. So we're talking about laws and why we keep, we keep amending laws and, at the end of the day, the law does not, in practice, we do not see it function. We just make good laws, but we do not put it into practice. So making anti-racist policy reforms is not just enough. It's important to also implement these laws. Also, putting a culturally competent mental health care, because a lot of people Black people are reluctant to get mental health care because of lack of culturally competent health care. And it's important to inculcate this in our mental health care services. Also, a community-led mental health initiative and education and awareness is important in the education system to spread the need to see everyone as an equal, everyone as a human being. Is important in our workplaces, is important in our families. Just like the speaker yesterday mentioned, what is not about placing things on the government to do. What can you as an individual do to stop racism and health disparity? It's not just about, placing it, the government has to do this, What role do you play? How can you be an agent of change? That's an important question to ask. Now we have seen that racism has a profound and multifaceted impact on the mental health of Black Canadians, shaping key social determinants and resulting to significant disparities. These challenges demand urgent systemic change in policy, health, delivery, and public awareness. Now, I'll leave you guys with this food for thought. In a world where systemic barriers persist, how can we collectively dismantle them to ensure equitable mental health outcomes for all? Thank you.
Thank you for that presentation. I'm really coming from a background of education, and whenever you teach something, you assess it. You assess for learning, you assess for your own teaching abilities, etc. And I'm wondering about the question that you pose about implementing these anti-racist policies. I'm wondering about evaluations and what can be done, or is there anything in terms of accountability evaluations about these policies to go back and follow up and assess about assess their effectiveness and accountability in terms of to make sure that these changes are being made? Is there anything in place, or can we work on something like that where we can go back and evaluate? And I mean, even with grants and things like that, you always have to report. You always have to go back and say, yes, this was a successful program. So that's my question for you. Thank you.
Hey, if my memory serves me correct, yeah, you asked about how to, more like assessment of the impact of the anti-racist policies and the implementation on the implementation of it. So personally, I would say that implementation is not there's no fixed approach to implementation. Obviously, it's a slow and steady means. It's not cast on a stone that once a policy is made, this is how it must go. Obviously, there will be shortcomings. There will be problems that would be obviously envisaged. But the problem is the aim or the goal is that in each step, can we really access or really acknowledge the fact that these problems persist, and we can actually reflect on it subsequently after going through implementing this particular policy? What happens at the moment is that policies are being made, but without being implemented. And next thing, people are critiquing the policy to make another one. When a particular implementation hasn't been made yet, you haven't reflected on what could be the problems or shortcomings of this particular policy. So I believe is a very important question. It's good to evaluate and see what are the problems that could be envisaged or could be persistent in the particular system, because there are obviously going to be a lot of factors that are going to hinder you or stop you in making sure that, for example, that racism goes away totally. It's always going to be there. But how can the essence of the law needs to be there because there is injustice. Without injustice, there's no law. Why do we have law if there's no chaos or if there are no bad people?
See that.
Exactly. Acceptance is a first.